Hey there VCE HHD students, my name is Andy, I'm a VCE Health and Human Development teacher. In this short video we're going to look at answering the 2021 VCE HHD Exam question number 8. Before we dive into question number 8, just a reminder at the Health Resources Hub YouTube channel, a new video like this one is coming out each day between now and the HHD exam this year. You can subscribe with the button in the bottom corner of the video there. Please let your HHD friends know they can do so too to get access to all of those videos. Also, you can see there our social media links if you'd like to follow us and get alerts to new videos coming out each day, as well as HHD exam tips. And you can email us if you've got any questions or suggestions videos you'd like me to work on. You can see here question 8, okay, from the 2021 exam was worth 10 marks. It started with a table with some information about Australia and Sierra Leone. And then A for 2 marks was asking, other than the Human Development Index, identify 2 characteristics of a low-income country. So it didn't break this into environmental, social, or economic characteristics, so you really could have chosen any examples. So things like low levels of access to healthcare, high levels of poverty, okay, were just a couple of examples you could have chosen, but there's obviously quite a list there, and make sure you know some of those characteristics of high, middle, and low income countries. Okay, B was then asking you to describe the HDI with reference to each dimension and indicator. So this was worth 4 marks, so it's quite a lot for a description. So you had to include the dimensions as well as the indicators, but then also 2 more pieces of information for 2 marks in addition to a mark each for the dimensions and indicators. So you can see that only 8% of the state was able to achieve 4 marks. And so obviously when talking about the dimensions, they're talking about long and healthy life, knowledge, and a decent standard of living. The indicators are life expectancy at birth, mean years of schooling, expected years of schooling, and gross national income per capita. But then you had to have 2 additional pieces of information about the HDI. So you could have said something, it was a measure of social and economic development of a country, or it was a tool developed by the United Nations to rank countries based on their levels of human development, or something along the lines of it being a single statistic that ranged between 0 and 1, where 1, okay, was closer to high levels of human development. So something along those lines would have gotten you the additional 2 marks. Then C was worth 4 marks and asked you from the table on page 10, select one difference in health status as evident between Sierra Leone and Australia and analyse reasons for this difference. So I often say to students, make it easy on yourself and try to choose, the easiest health status indicator, and I typically think that that is life expectancy. So you could have started by mentioning, okay, the life expectancy at birth for Australia was 83.4 years, whereas Sierra Leone was lower at 54.7. And then you had quite a bit of range there, okay, to talk about reasons for this difference. So I'd try to focus on probably at least 2 reasons, okay, and link those back to the difference in life expectancy. So you could have chosen things like the difference in levels of poverty, okay, between Australia and Sierra Leone, difference in levels of access to healthcare, could have talked about discrimination, okay, difference in levels of discrimination. So there's quite a lot of different things you could have talked about. You can see in the example given there as a high scoring response, they talked about a difference in access to healthcare and talked about how that could be lower in Sierra Leone. That means if someone contracts a virus such as a flu, okay, their immune system is more likely to, be compromised, and with no medical attention, that could lead to death and that could lower their life expectancy. And then they talked about environmental conditions like inadequate housing, okay, and talked about how that might have an impact on people not being protected, okay, from things like extreme weather, and that might contribute to premature death and lower their life expectancy. So there was quite a lot of range there, okay, in the different factors you could have chosen and linked back to whatever the health status indicator was that you chose for that question. Okay, hopefully you found that useful. A reminder, the Health Resource Hub YouTube channel, our social media links, and our email. Thanks so much.